interesting point you made about sound being more than 360 degrees. You talk about critical incidents like glass breaking, aggression, gunshot sounds. How important is the ability to localize those sounds to people who are analyzing that data or getting that data through a feed?
It's a different answer for a different use case. You know, if there's an active shooter on sites, and not that we're focused too heavily in security solutions or defense today, but if there is, as an example, we're not just able to classify that weapon type based on that sound signature, but if there's multiple microphones in an array, even distributed through multiple cameras across the courtyard, there are ways to virtualize and localize that moment. So we can actually get you the exact weapon classification. So is this a handgun that could be concealed or an assault rifle that has, it's just frankly a different level of threat. Also being able to understand from an omnidirectional perspective with multiple microphones, the approximate distance and direction that that active shooter came from. There's a different level of threat and the nature of localization from that use case versus a lot of the work we're doing today in a very underserved market, especially acoustically, in hospital rooms. We're very focused on healthcare and specifically around the patient experience and how disruptive those beeping hospital poles, I want to say on the environmental side are, and alarms and machinery, but also the behavioral nature of coughing, wheezing, heavy breathing, and the myriad of other sounds in those use cases. So I'd say from a localization perspective, the security aspects and defense aspects definitely require a more granular level of detail than helping to enhance patient experience, though it's incredibly disruptive when you think about restful sleep means faster recovery times, improved outcomes, higher patient experience scores, and therefore stronger reimbursements through Medicare. It's actually a reimbursable factor. So we've been able to kind of piece that business case together throughout COVID. It's actually helped in a lot of ways. And then the other side of that too, that brought us more deeply into healthcare and specifically in the hospital room. My little sister suffered from Still's disease for the last 20 years. So as she spent a ton of time, and when I was 21, she literally was in Stanford Hospital for 10 and a half months, transferring between units and beds. And it was a very painful experience for her, but also for our family. So she spent, I would say, the greater portion of her life in hospital rooms, overnights specifically. Our family spent a ton as well. And me specifically over the last couple decades have spent a lot of time trying to get rest. And it's very, very challenging when you think about 8 hours of sleep is a third of our life.
Absolutely.